Chair lays out House Bill 220. The chair recognizes Representative Ordaz to explain the bill.
Thank you, Chair Campos, members, for allowing me the opportunity to present this important piece of legislation today. I also want to thank the bipartisan co-authors that are sitting on the dais today as well. House Bill 2020 would ensure timely access to emergency contraception for survivors of sexual assault during forensic exams. In 2022, the Texas Attorney General's Office and the Texas A&M Health Center of Excellence in Forensic Nursing updated the Texas Evidence Collection Protocol as a resource for medical, legal, law enforcement, advocacy, and forensic science professionals who provide care for victims of rape. And I have that protocol, that manual here with me, if you all want to take a look at that. The report also sets minimum standards of care that must be provided to sexual assault victims during and after a sexual assault nurse examiner exam, or SANE for short. The protocol includes guidance for providing emergency contraception with informed consent as part of the exam. Emergency contraception is a form of birth control meant for specific emergency situations, not as a regular contraceptive. It works by preventing ovulation or the release of an egg from the ovaries. The protocol clarifies that emergency contraception is different from medications used to terminate a pregnancy and will not interfere with an existing pregnancy. This bill seeks to codify the Texas Evidence Protocol guidance into law, ensuring survivors receive essential care following such a traumatic event. House Bill 2020 aims to facilitate timely access to emergency contraception for survivors of sexual assault during their forensic examinations. Given that emergency contraception is effective only within 120 hours following a sexual encounter, this legislation seeks to alleviate the burden on women by eliminating the need to navigate through multiple providers or pharmacies in urgent situations. House Bill 2020 stipulates that emergency contraception may only be provided with the patient's consent, and minors must have parental approval. I am joined by two witnesses who are experts in women's health care and survivor care, and a law enforcement officer to answer any questions. Thank you again, members. I'm open to any questions and reserve the right to close.
Thank you, Representative. Any questions? Representative Frank.
Yeah, thank you for bringing this bill. I just want to make sure, because obviously anytime you start talking about this issue, this prevents, I guess, could you walk through that part of it again? Because it is not an abortifacient. It is not, because it's, yeah. So would you walk through that?
That's exactly right. And I've had to have many of these conversations.
Oh, no, and I have as well. And
I'm very used to this question.
I have checked and rechecked with people.
Yes.
I've joined authored the bill. I think we need, it's very, very important. And I just want to make sure for the record that it's said again.
Yes, no, thank you, Chairman. I appreciate that. No, emergency contraception is, the purpose of it is just to delay ovulation, the release of an egg to create a pregnancy. So this would just delay that process. And after a forensic exam, you have about 120 hours after that traumatic event happens to receive this care.
Okay, thank you. Thank you very much, Chairwoman.
Representative Schaffner.
What if ovulation is already occurring?
Well, that's after a pregnancy test is issued. So after it's standard practice, best practice, that a pregnancy test is given, and that's found in this protocol.
Okay, thank you.
Thank you. Representative Jones.
So you're raped, you go, I guess, to the healthcare provider.
It could be a hospital or it could be a rape center. Yes.
Or you call the police and they send you to victim services and they do all that stuff. So you go there and then what happens?
So there's an examination and I can kind of walk you through it. So within 5 days after the assault, there is an exam that happens, and that's to check for STIs, for example, just to check, unfortunately, in some severe cases, strangulation in that traumatic event. So they go through a myriad of things with that victim of that assault, and that can happen within 5 days of that event. And if it's a minor, there is no timeline as far as how many days that minor can get that examination. Whenever.
Okay, thank you.
Thank you. Any other questions? Representative Pearson, I'm so sorry.
Thank you, Vice Chairwoman. Thank you for the bill. I do understand what you're trying to do, and it's very noble, but I think the question on conception and the number of days and testing positive or negative for pregnancy comes from the fact that a lot of times you won't test positive for a pregnancy test if you are pregnant for at least a week. It could take up to 10 days even through a blood test, not just urine, to know that you're pregnant. I think that's what the concern is.
Understandable. And as the chairman mentioned earlier, as far as birth control versus abortification, birth control is just to delay, and we can speak as ladies on this, just to delay ovulation, right? It will not impede or impact a pregnancy. If you're pregnant and you take emergency contraception, the pregnancy is already there. It only seeks to delay ovulation.
Right, I understand. And the feedback I'm receiving is that although that's true, it still could provide a hostile environment for a fetus.
And we have healthcare providers that can speak to that.
Wonderful. Thank you.
But
Thank you.
yes, I can't speak to that. Like I said, the data is clear as far as just what emergency contraception is, and it's strictly just to delay ovulation, not to impact a pregnancy.
Any other questions? Thank you, Representative. You reserve the right to close. The chair calls Nancy Downing, Madison Ramirez, Michael Sweeney, and Kara Morris. House Bill 220. If not, Chair recognizes Representative Ordaz to close.
Thank you, members. These are difficult conversations to have, and I appreciate the thoughtful questions. And Representative Jones, thank you for sharing that story. These are really traumatic events that a lot of women are experiencing. And so what we're hoping is that through this legislation, the point is to prevent a pregnancy from happening after such a traumatic event. And so, it's outlined through the Texas Attorney General's Assault Prevention Crisis Program and through the Texas A&M Center of Excellence in Forensic Nursing. So this is just codifying what's already outlined. And that's what this bill seeks to do. So I appreciate you all giving me the opportunity to lay this bill out before you all. I'm here to answer any questions. If not, I close.
Okay. Vice Chair Campos.
I just want to thank you so much for putting so much thought into this bill. I think it's a good bill and it's needed, so thank you.
Thank you, Vice Chair Campos.
Representative Alcott.
Thank you, Mr. Chairman. Representative, would you be open to tweaking the language in that last paragraph in the bill to more specifically define the types of medications that can be used?
I'm happy to sit down with you and meet with the advocates, absolutely, and let's see if there's something that we can work through. Absolutely, I appreciate that.
Thanks.
Any other questions, members? If there's no objection, House Bill 220 will be left pending. Is there objection? Chair hears none. House Bill 220 is left pending.
Thank you, members. Appreciate it.
Thank you.